Hello, this is Dr. Susan Mara with Dr. Mara's Medical Minutes. Have you ever thought about how it is that you treat complex chronic illness, which is tick-borne illness, COVID, mold exposure, environmental illness? It's very complicated. That's why it's called complex illness. I've been working in this field for 25 years now, and without question, over that time, I've seen quite a bit of change in what is presenting and what the environment is like. For example, 25 years ago, when I was practicing in Connecticut, you really only saw Lyme disease. Occasionally, you would see Babesia or Bartonella, but not like we see it now. Now, I don't have any patients in my practice that have only one infection. Most of them have many more than one infection, and that includes viruses, bacteria, and fungal infections. So when I have a new patient, what is it that I start with? Well, I start with the basics, okay? So first of all, we want to stabilize the mast cells. We want to make sure that there's proper hydration with electrolytes. We want to make sure that there's a good diet, and that means low inflammatory foods. And we want to make sure that you have excellent sleep hygiene. So that's 8 hours of sleep a night, with several entries into REM, rapid eye movement sleep, and deep sleep. And the other thing that can be helpful right out of the gate is something called vagal retraining, and that's retraining of the vagus nerve. The vagus nerve seems to get severely compromised in complex chronic illness, and there's a number of different programs that are available. The one that's really starting to gain momentum is one by Kathleen King called Primal Trust. And so you can go to that website, Primal Trust, Kathleen King, and check it out, see if that's something that you're interested in. The other thing is you need to identify the infections. Is it bacterial? Is it viral? Is it fungal? Is it COVID? Is it long COVID? These things matter. Are there secondary infections? Because the more infections there are, the greater the pathogen load, and the harder the immune system is going to have to work. So in my practice, I use a lot of common sense in regards to treating tick-borne illness and complex chronic illness, including mold. Mostly what you want to try and do is lower inflammation, stabilize the mast cells, lower the pathogen load, increase immune function, and increase detoxification. Now, it's not just that easy. You need to balance the hormones. You might need to get rid of heavy metals. You might need to deal with SIBO. You might also need to deal with hypermobile EDS. You might need to deal with POTS. I mean, there's a myriad of things that need to be dealt with. But I'm just trying to give you an idea of how I begin and start to work with a patient. One of the first things we do is open up the drains. So begin to drain the patient, start to begin to detox. And the best thing to use for that is the Picana formulas, Iteres, Renalex, Apohepat, Inflamar, Juvical, Mundipur, and they begin to move toxins out of your body. And as that happens, you can begin to start to tackle other things like stabilizing the mast cells, vagal retraining, decreasing inflammation, getting the diet, sleep, all these things. So there is sort of an order. I would say the most important thing is you've got to stabilize the mast cells and you have to get really good sleep. Those two things have to happen first. Oh, and you have to detox. So beyond that, it's a very individual sort of treatment, and that's why personalized medicine is the most helpful in dealing with complex chronic illness. So I hope this information has been helpful to you, and I hope you have a wonderful day.